Most people think that rheumatoid arthritis only affects the joints. But if you've ever woken up feeling sore all over, like your muscles ran a marathon that you never signed up for, you're not imagining it. RA can cause muscle pain, tenderness, and even weakness. And understanding why it happens is the first step to fixing it. I'm Dr. Neha, rheumatologist. Today, we're breaking down why your muscles hurt when you have RA, what the research says, and what really helps. Let's dive in. Sometimes you look at your blood work, your labs, and you're like, these are perfect, but I feel miserable, like sore everywhere. That muscle pain isn't imagined, and it's not always from inflammation in your muscles, but there are small changes that you can do that can help you feel better. Stick around and we'll get to that just in a minute. RA is a systemic process. And what that means is that you have all these immune signals that are traveling through the bloodstream, and they can also inflame muscle tissue too, not just the joints, the cartilage, the tendons. Studies that have been done with MRI and actually taking a piece of muscle, like muscle biopsies, researchers found that there is low-grade inflammation in the muscles of people who have rheumatoid arthritis, even when their joint swelling was not so bad. You may have heard me talk before about different cytokines like TNF-alpha, IL-6. These are the same ones that damage cartilage, and they can make muscle fibers more sensitive and slower to repair after daily activity. So that heavy, achy feeling that you get in your arms or thighs isn't necessarily weakness from aging, it's your immune system staying in overdrive. But also know that true myositis, which is that real muscle inflammation condition, is very rare and not really typical of rheumatoid arthritis. Conditions like polymyositis, dermatomyositis, they can be overlap conditions, but really not common here. What's actually happening in most RA-related muscle pain, it's more a secondary or systemic effect rather than true myositis. And what I mean by that is, remember I told you there's more cytokines that are active when you have all this inflammation? Well, that chronic exposure that you're getting to those cytokines that are unregulated is driving muscle breakdown. It's causing that muscle tissue to be smaller, the fibers in it are weaker. So it's not actual inflammation that's coming in, but those little fibers are just not as strong as they should be. And there's a couple different names for this, if you've ever heard them: rheumatoid cachexia or inflammatory sarcopenia. So the general public can have sarcopenia, which is this muscle loss, but when you have RA, you could have an inflammatory or inflammation version of it. Another very common one with rheumatoid arthritis is something called central sensitization or pain amplification, also known as fibromyalgia, which is about 30 to 40% of RA patients. So it's actually pretty high. And it makes sense, right? Because when you're in a state of chronic pain, pain begets more pain, and it just feels overall amplified. This kind of gives you this widespread aching and tenderness in your muscles. But if you look at your actual blood tests and the inflammation markers, they'll usually be normal. So it feels like muscle inflammation, but it's more neurochemical because the pain pathways are just staying very hyperactive. Another big category is deconditioning, disuse mechanical strain. When you're in pain, you're avoiding moving your muscles too much, right? It hurts to move. But this leads to weakness, tightness, and the secondary soreness. More of a mechanical nature. The fault might be the RA, right? Because your joints are hurting, but because of that, you're not moving. Muscle is metabolically active, and you need to move to use that muscle and to keep it active and happy, and the fibers very nice, and you're not doing it when you don't feel good. And don't forget the effects of medication themselves. For example, vitamin D deficiency, that's been associated with more complaints of weakness with rheumatoid arthritis, or more muscle aches, or even taking cholesterol medications like statins, which by no means am I saying not to take. If you have cholesterol issues, you need medication probably, unless you can really amplify your diet and lifestyle. Most of the time people do need those medications. Just know that there are other ones, like if they start you on one, there may be that another level up may not cause as many of those muscle aches. So you may need to chat with your prescriber and see if you can use a different medicine for your cholesterol. But also steroids, something we give all the time. I know I give it all the time, and it works so fast. So it's unfortunately this necessary evil that we often have to do. But if you're taking long-term steroids, it can cause something called steroid atrophy. And that's basically your muscles breaking down. And the cause of this is really the steroids. It's not always easy to tell. Sometimes you do need to get a little piece of tissue, a muscle biopsy, but that is another cause that we often ignore. Can we actually treat this muscle pain, muscle soreness? Yes, there's actually quite a few things we can do to improve the situation. First of all, we need to treat that inflammation to the joints, the cartilage, the tendons, the medications that we have that we're commonly using, whether it's DMARDs, biologic agents, because we want those areas to reduce their inflammation so that your muscles will overall feel better. So that's one thing you can do. Because studies show that when you achieve remission or something called low disease activity, you can regain more lean muscle and lower those global activity pain scores. Avoid steroids whenever you can. If you need it, you need it. But otherwise, if there's another way to address the situation, try using that first. Because they do reduce inflammation, but they also promote muscle wasting. So long-term wise, you may not feel great. Bottom line, control the inflammation. You can't rebuild muscle if you have active cytokines floating around everywhere. Number 2, reverse that deconditioning. Do progressive resistance exercise training twice a week. Start with just twice a week until you can head to 3 times a week. This has shown to improve strength and fatigue in rheumatoid arthritis, but you have to do it. A lot of people remember to walk, they know they have to move, but they don't remember to do resistance exercises. And it is still important to do that low impact aerobic exercise, whether you're walking, you're swimming, you're bicycling, even that can reduce TNF alpha levels and those other cytokines. And you can also do gentle mobility work like Tai Chi, yoga. That improves overall flexibility and coping with pain because it's not easy to have this condition. So what's a quick tip for you? Start with short 5 to 10 minute sessions, nothing more, just to kind of get used to this, because consistency is going to matter more than intensity over here. And of course, I have to talk about food because I love to talk about food. Muscle rebuilding and improving inflammation also depend on your diet. So protein, you need to have adequate protein. When you're kind of in your younger years, you're using protein to build muscle, to feel healthy, appear healthy. As you get older, you need more protein. And to top it all off, when you have RA, you need even more protein because you're having that breakdown regardless if you have active disease. So your goal for RA and protein can also be a little bit higher than the general population, something like 1 to 1.2 grams per kilogram per day. You can do lentils, tofu, Greek yogurt, fish, eggs, dairy if they don't bother you. Omega-3 fats have been shown to be helpful for rheumatoid arthritis. Higher doses like 2 to 3 grams per day generally were better than the lower ones. They weren't as effective. Eating an anti-inflammatory pattern of food, whether it's the Mediterranean diet, the itis diet that's been shown in rheumatoid arthritis, or any of the others. But think about a more plant-forward, plant-rich diet with colorful produce, olive oil, nuts, whole grains, and vitamin D. It's not that hard to replete it. I know it's not so easy to get in your diet, and it isn't. That's one vitamin that is not so easy. It's okay to take a supplement, aim for above 30 nanograms per milliliter. I've had some people get toxic recently because they're thinking that it's going to really help their RA. No, please don't get to those higher, extremely high levels because it's not going to help any more than being in level, because we've seen that lower levels of it can correlate with pain and weakness. Now, if your pain is really more this widespread burning pain and it's really persistent despite your joints really not feeling too bad, approach it more with graded activity. You want to gradually re-expose your body to normal movement to desensitize those pain circuits. Cognitive behavioral therapy or mindfulness programs can also be helpful. It can help that sympathetic overdrive that you can get when you're in this state of chronic pain. Sleep restoration. You need deep sleep. You need good sleep, not just superficial sleep. Sometimes medications are used for that if lifestyle is not working. And if you need them, there are different medications there for widespread pain, whether it's duloxetine, pregabalin. There's so many. You may not need excessively high amounts. Sometimes when you put in all the lifestyle tools, different pillars that you can address, you may still need medication, but hopefully not as much medication. The pain is real, but it's being generated by the nervous system, not new joint damage. Back pain also can be very common with rheumatoid arthritis because of this disuse of muscles and mechanical strain. And sometimes it's hard to tell apart what is RA and what is sciatica. So I actually do have a video coming up on that. You can watch it right there.